That push is happening here too. In the Greater Toronto area, it's been amplified by the deaths of Ejaz Choudry, Campbell and Regis Korchinski-Paquet. All three died in confrontations with police. All three people of color. Unlike George Floyd, each of them was in the midst of a mental health crisis. The officers involved were cleared of wrongdoing in all three cases, but could it have turned out differently? The City of Toronto has launched an $11 million program to create teams that can respond to mental health calls without police officers. It is the largest single policing alternative program created in Canada since Floyd's murder. I was in Toronto on assignment, so took the opportunity to sit down in the neighborhood of Regent Park with Denise Campbell, the woman leading the effort. Thank you very much for joining us.
Thanks for having me.
You know, in the aftermath of the murder of George Floyd, a lot of people in North America talked about defunding the police. What does that phrase mean to you?
That phrase means that the institution of policing doesn't wholly have the trust and confidence of all people that it's meant to protect and serve. It means that governments and police need to look at that institution and reimagine it. It means that we need different responses. And it means that some of the resources that goes into policing need to fund proactive and preventative responses.
And so describe for me how your pilot project would be different when it comes to responding to calls.
So we are building a community crisis support service here in Toronto. That service is non-police led and non-police intervened. And so what that means is we're building mobile crisis intervention teams that will work for community agencies, so maybe a community health center and some service partners. These mobile crisis teams may have nurses, elders, harm reduction and crisis workers, peers, and they'll go into a community when the call comes in for someone that's experiencing a mental health crisis or having a substance use issue, and provide them with the kinds of supports that they need to get them connected to services, maybe a detox bed, whatever they need to be able to withstand the crisis that they're in and hopefully connect them to long-term services. That's not a policing response.
So if this pilot project works the way you hope it does, and if it's expanded, what's different? What will change in terms of outcomes?
So I think the long-term view is still to be negotiated, whether this service sits alongside something that happens within police. But community vision, and I believe what Toronto City Council is supporting, is a wholly independent, community-led service, and that's going to actually support Torontonians in having a healthcare response to a mental health crisis and connect them to the kinds of services that they need in the long term.
Do you think it's going to save lives?
It absolutely will save lives. And that is, I think that is incredible and terrifying at the same time.
Terrifying in what way?
Well, I'm a public servant that, at the end of the day, is really about creating the types of change that will really work for Torontonians. And the fact that people's life could be at risk if we get this model wrong weighs on me and weighs on my team. And it certainly is something that's important to community and that we've heard a lot about. So there's interest for us to go big. There's interest for us to do this fast. And one of the things that anchors us in this work is do no harm.
One of the challenges I can think of is where you have somebody who's in mental distress, let's say in the City of Toronto, threatening to harm themselves with a knife. So they have the weapon in their hand. How, in your pilot project, would your team deal with that without the police?
So first of all, the teams would include people who are trained in harm reduction, in de-escalation techniques, and that would be a skill set that they'd be using in response to calls where that kind of threat is present. We've also looked at, 53 models across 50 jurisdictions, and one of the things we've learned about some of the ones that have been long-standing, like Cahoots in Oregon, is that it's a very, very tiny percentage of calls where there's any violence as part of the scenario. And then ultimately, though, we're not saying police have no role, because if there is a situation in which violence is very present, then of course police can come and support the team. It's just not the first response or the default response.
One last question. What do you hope the legacy of George Floyd is in Canada?
I hope that the legacy of the murder of George Floyd is that institutions of policing and governments really look at themselves, own the fact that systemic racism, systemic anti-Black and anti-Indigenous racism and bias is very much part of that structure, and that they need to do some fundamental things to win back the trust and confidence of all people that they're mandated to protect and serve. And that maybe it's about detasking the police from some of the things that they've taken on over time that really isn't appropriate for a law enforcement role. And maybe ultimately that some of those resources actually go to supporting more proactive and preventative things that would actually support communities to thrive.
Lots of interesting stuff. Really nice talking to you.
Nice talking to you too. Thank you.